What should you know before an OB-GYN exam? What's appropriate, what's not appropriate, how you can protect yourself? We're going to get into it. My first piece of advice, and this is so important, is that it is recommended for both the patient's safety and comfort and also for the healthcare provider's protection to have what's called a chaperone in the room. This is a paid medical professional who is there to oversee any part of a physical exam that's performed on a patient. In my 20-year career as an OB-GYN, I have never once examined a patient without a chaperone in the room. What about bringing a friend with you into a physical exam? By all means, that is the patient's prerogative. I personally have never said no to that. It can get a little crowded in the examination room because there's usually a medical assistant, aka a chaperone there on the part of the healthcare provider, and then the patient, and then whoever the patient brings. But by all means, if that's something that you feel makes you more comfortable, that's something that in general absolutely should be permitted, especially for an OB-GYN exam. The other thing that I think is very important in an OB-GYN setting, there should be draping, there should be the utmost steps and precautions taken so that the patient's privacy is respected and so that only the body parts that need to be exposed are exposed. The patient's permission should always be obtained, ideally, before performing a physical exam. It is always within your right to ask what will be done in advance. And I want to be crystal clear, when done properly, an OB-GYN exam should take seconds, 20 seconds, 10 seconds, at most maybe 30 or 45 seconds. It should not take minutes. And there is nothing sexual about it. So any kind of subjective commentary about looking good or feeling a certain way that feels non-medical is not appropriate. I also think it cannot be stated enough, trust your instinct, trust your gut. If something doesn't feel right to you, if you feel uncomfortable, speak up, stop the exam, tell someone. Don't go back to that healthcare provider if you are really getting feelings that something is not right. And lastly, gloves, medical latex gloves, medical surgical gloves should always be worn for an OB-GYN exam. Period, full stop, end of sentence, no questions asked.